All right. Hi, everyone. Happy Friday. I'm Michael Durham. My pronouns are he, him, his, and I work for the National Healthcare for the Homeless Council here in Nashville. And I'm really grateful that you joined us today for this webinar coming up on a weekend that here in Nashville we expect to be really beautiful. I want to start by acknowledging the intensity of the moment that we find ourselves in this year. We are living in an escalated, traumatizing environment, and I know that most of us, if not all of us, are really weary. And I just want to start by saying thank you for the work that you do and just who you are in the world. It really encourages me to continue to do the work that I do and keep showing up every day. So just wanted to start with a word of thanks to all of you. And I hope that you can find some rest this weekend. Couple things to tell you before we proceed. First, just a disclaimer that this is a private webinar, so please don't report us to any of our particular funders. And next, I wanted to encourage you guys to introduce yourselves in the chat box, not the Q&A box. We'll use the Q&A box for questions to the panelists, but we really want you to engage with one another. The council is big on peer learning, and just invite you to share where you are, where you work, what your pronouns are if you want in the chat box so we can get to know each other a little bit. And it's Friday, so let's be silly, if that's okay. Another note here, this is actually a 75-minute presentation. I know some of you registered expecting it to just be 1 hour. This is a huge couple of issues, so we wanted to give ourselves a little bit more room to talk. If you do need to leave at the hour, of course, this is being recorded, and you can catch the last 15 minutes of the recording later on. And then finally, before we get started, I just wanted to situate this webinar in a broader context here. The council has 6 principal concerns that here within the staff we've been referring to as the deathly hallows or the horsemen of the apocalypse, pick your metaphor. But just some really concerning things as we head into winter months. And I acknowledge that, you know, one of our panelists in Minneapolis, it's been cold and snowy there for quite some time. So winter is here for many of us. So those issues, as you see on the screen, are a surge of coronavirus, flu season, cold weather, and natural disasters. And we tackled those 4 issues in 2 respective webinars of the past couple of weeks. You can catch those recordings on our website. And today we're talking about the wave of evictions and social upheaval. The eviction wave, I think, is pretty self-explanatory, but what do we mean by social upheaval? What we're talking about here, of course, is the uprisings of the summer, specifically in response to the murder of George Floyd and other Black people in this country at the hands of police. And wrapped up in that is the trauma of the protests, which are good, but then the counter protests, the counter police violence and protests of the police violence. And really just the collective trauma that we're all experiencing from the heaviness of, you know, the coronavirus pandemic, but also just heightened structural white supremacy that we're all suffering from. And many of us in different ways, of course. So we just want to hold space today for these 2 really difficult issues. And we've got some really exciting speakers lined up to help us with that. And I think that's all I needed to get through before we introduce our panelists. So really excited that we've got Kim Johnson from the National Low Income Housing Coalition, who will give us a national overview of what we're seeing on evictions, followed by a local perspective by Josie Williams in North Carolina. Then we're going to hear from an organizer in Portland, Maine, Jess Falero, talking about some protests and organizing that they've been doing, in addition to an organizer and nurse practitioner in Minneapolis, which of course was where George Floyd lived. And I'm Michael, I work for the council. So without further ado, I will pass the mic to Kim Johnson and the video, and then I will move your slides for you.
Awesome. Thank you so much, Michael. And hi, everyone. Like Michael said, my name is Kim Johnson, pronouns she, her, hers, and I'm a policy analyst at the National Low Income Housing Coalition. NLIHC is a national nonprofit dedicated to achieving socially just housing policies that ensure the lowest income people have safe, stable, accessible, and affordable housing. So before turning the conversation over to the incredible advocates and activists that I'm lucky to be sharing this space with today, I wanted to provide a little bit of context to kind of situate the historic moment in which we find ourselves. So we'll start with a short discussion on racist housing policies and practices that have ensured communities would remain segregated, discuss the legacy of those policies and their ongoing impact on marginalized communities, and explore how the pandemic has exacerbated longstanding inequities. Michael, if you could change the slide. Awesome. So in the 1930s, the federal government began providing low interest rate mortgages to prospective homeowners. They created color-coded maps to reflect the risk associated with issuing a loan in a particular neighborhood. And assessment of risk was tied directly to the racial composition of those neighborhoods. White neighborhoods were considered low risk and designated green, and Black or integrated neighborhoods were labeled high risk and designated red. So this process is known as redlining, and with it, the Federal Housing Administration locked Black and Latinx households out of using federal assistance to purchase or improve the conditions of their homes. Banks and subsequent federal, state, and local policies followed the FHA's lead. Local speculators and real estate agents also engaged in the practice of blockbusting, where speculators bought properties in white neighborhoods and rented them to Black families at above market prices, then persuaded white homeowners in the area to sell their home because their now integrated neighborhood would soon cause their property values to fall. And this practice also helped facilitate white flight, which is the large-scale movement of white people from cities and into the more segregated suburbs. When construction of the interstate highway system began in the late 30s, Black and Latinx neighborhoods were labeled as blight and demolished, which displaced residents, destroyed local economies, and exposed inner city residents to increased pollution. And while the Fair Housing Act of 1968 prohibits discrimination in housing on the basis of race, color, national origin, religion, sex, familial status, and disability, the law has never really been adequately enforced. And so these federal, state, and local policies and practices created a system of de facto segregation, filtering money and resources into predominantly white neighborhoods and concentrating Black and Latinx families in disinvested inner cities, where there were fewer jobs, less access to nutritious food and quality housing, and greater exposure to environmental pollution. These policies are one of the roots of the gaping disparities in health that have made coronavirus more deadly to Black, Latinx, and Native people. Next slide, please. And even before the COVID-19 pandemic, the country was in the grips of a pervasive affordable housing crisis. Nationally, there's a shortage of approximately 7 million homes affordable and available to the lowest income renters, so those earning 30% or less of area median income. And there's not a single state or congressional district in the country with enough affordable homes to meet demand. Next slide, please. When extremely low-income households cannot access affordable homes, they must compete with higher income renters for housing that they cannot reasonably afford. And as a result, 11 million renter households are severely housing cost burdened, meaning they spend more than half of their incomes on rent and utilities every month. And 8 million, or nearly 3/4 of severely housing cost burdened renters are extremely low income. Next slide, please. Black, Native, and Latinx households are disproportionately represented among ELI renters. White households account for 65% of all US households, 50% of all renter households, and 43% of extremely low-income renters. Meanwhile, Black households account for 12% of all households, but 19% of all renters and 26% of all extremely low-income renters. And Latinx households account for 12% of all households, 19% of all renters, and 21% of extremely low-income renters. Next slide, please. So in addition to the extreme shortage of affordable housing, another fundamental problem is the mismatch between what people earn and what housing costs. Since 1960, renters' incomes have increased by 5%, while rents have increased 61%. High rental costs and low wages leave housing cost burden renters with few resources to cover other necessities like medical care or nutritious food, and put them at risk of housing instability and homelessness. NLHC releases an annual report called Out of Reach, which estimates each locality's housing wage, which is the hourly wage a full-time worker needs to earn in order to afford a modest apartment without spending more than 30% of their income on rent. So in 2020, the national housing wage was $23.96 per hour for a two-bedroom apartment and $19.56 per hour for a one-bedroom rental. The average minimum wage worker must work nearly 97 hours per week, more than two full-time jobs, to afford a two-bedroom home, or 79 hours per week to afford a one-bedroom unit at fair market rent. And while the housing wage varies from state to state and county to county, in only 5% of all US counties can a full-time minimum wage worker afford a one-bedroom rental home at fair market rent. And as I stated earlier, Black, Latinx, and Native households have faced decades of ongoing racist discrimination in not only accessing affordable housing, but in accessing the tools to build economic security. These longstanding issues are part of the foundation of racial differences that we see in health outcomes, poverty rates, involvement with the criminal justice system, housing affordability, and homelessness. Next slide, please. And the coronavirus pandemic has magnified and accelerated this crisis. As of September 2020, 60 million Americans had filed for unemployment, and over 20 million renters lived in housing that had suffered a coronavirus-related income loss. Millions of households are struggling to afford rent, and without federal action, an estimated 30 to 40 million people will be at risk of losing their homes by the end of the year. Next slide, please. And Black, Latinx, and Native people have been disproportionately impacted by the pandemic and bear the brunt of coronavirus infections, fatalities, and coronavirus-related financial stress. Next slide, please. 60% of Black households, 72% of Latinx households, and 55% of Native households reported serious financial problems compared to 36% of white households, and 28% of Black households, 32% of Latinx households, and 25% of Native households have reported difficulty paying mortgage or rent compared to 15% of white households. Next slide, please. So in response to the ongoing pandemic, the CDC enacted on September 4th a federal moratorium on evictions for non-payment of rent, citing the historic threat to public health posed by coronavirus. And while essential, the moratorium only postpones evictions. When the moratorium expires in December, on December 31st to be precise, millions of people will be at risk of losing their homes. Congress passed the CARES Act in March of this year, which provided funding for homelessness services and housing stability that has been crucial to helping communities respond to the pandemic, but additional assistance is urgently needed to ensure that people are able to find and maintain safe housing in the middle of a pandemic where our collective health relies on our ability to remain housed. Next slide, please. So first, we must expand the CDC's moratorium beyond its current December 31st expiration. And ideally, we need a national uniform moratorium on evictions and foreclosures that takes the burden off of renters for applying for those protections. Research shows that at least $100 billion in emergency rental assistance is needed to avoid creating a financial cliff that renters fall off of when the moratorium lifts and back rent is owed. Additionally, $11.5 billion is needed to reform congregate shelters and provide safe non-congregate housing for people who are unhoused. And $26 billion is needed to create new emergency vouchers for people at risk of or experiencing homelessness. And to maximize these resources must be targeted to communities most impacted by coronavirus. Communities should use federal funding strategically and across key public health and economic recovery stages in order to ensure assistance is reaching those with the greatest need. Next slide, please. And even while we work to respond to the immediate threats posed by the pandemic, we have to push for policy solutions that will help address the underlying affordable housing crisis that has contributed so heavily to the disproportionate impact of the virus on Black, Latinx, and Native communities. So first, we need to bridge the gap between income and rent. We must expand, repair, and preserve existing affordable housing infrastructure and establish a national housing stabilization fund to help extremely low-income renters recover after unexpected costs that put them at risk of eviction. We must also create a housing voucher entitlement program to ensure that all people in need of housing assistance are able to receive it. And we must work to expand and strengthen fair housing protections. And once again, all of this must be done with a focus on targeting resources to communities and households that have been historically disenfranchised and who have been most impacted by the pandemic. Next slide, please. And so that's my contact info. I am happy to answer questions. And in the meantime, I'll turn it back over to you, Michael.
Thank you so much, Kim. Really important overview of the crisis that we find ourselves in related to housing and evictions. So I really appreciate the work that y'all do. The Out of Reach report I cited every year, all of my presentations about homelessness. Really appreciate the work that y'all do. So we're going to get to a more local perspective now. Josie, I'm going to turn it over to you. Stop sharing so that you can share your slides.
Thank you, Michael, and thank you all for joining us today. I'm going to try to share my screen. And Kim, thank you for giving us that perspective on such a broad and national level. I'm going to let you guys know what's going on in our environment here locally in North Carolina. Narrow it down to the county, Guilford County, and our city level data in Greensboro and what our agency is doing here in Greensboro, North Carolina. So if you just bear with me. Okay. Can everyone, I guess, Michael, are you able to see this screen? I just want to check in.
Yep, looks great.
Okay, great. All right, so just for context, the Greensboro Housing Coalition is a housing agency. We advocate for those who are homeless or at risk of being homeless. We provide resources to people with low to moderate income and try to connect them to resources to meet the need that could range from anywhere from homeless prevention, foreclosure prevention. We have a Healthy Homes initiative. We have a department that focuses on improving the conditions of the home because we do often run across situations where someone is living in a home and it's literally making them sick. And so we want to be able to eradicate that. But what we see happening locally and on a state level is, as Kim mentioned, we see this happening across the country. Specifically here in North Carolina, we're looking at the fact that we were already in a housing pandemic before we had these challenges related to COVID-19. In North Carolina, before this, of course, we were already looking at having to have $17.67 per hour wage, meaning you need to be working 97 hours per week in order to afford a 2-bedroom. So many of our residents in our state are cost burdened, meaning you are paying over 30% of your income on your housing. When we look at what's going on in Guilford County, 30% of Guilford County residents, families are cost burdened. That's over 61,000 households across the county. You can see the illustration from this slide, what it would take for a family to afford a modest 2-bedroom apartment. This word modest at $806 a month is completely beyond the affordability range of our most vulnerable, our low income to moderate income individuals that we see day in and day out. A family needing to make at minimum $32,240 a year. That's not a lot of income when you're putting into the perspective of your home basic needs, your insurance, just your basic care for your family. When you average that out, the average renter can only afford $766 dollars a month in rent. And again, that does not speak to our most vulnerable and what those needs are. What we see here in Greensboro is even more drastic. Fair market rent here averages $747. That was as of 2017. So we need to have at least almost $3,000 a month and $29,000 annually versus that illustration that I just showed you. And that's assuming that you work 40 hours a week, 52 weeks a year. So you need a housing wage of at least $14 an hour. And in North Carolina, our minimum wage is under $8. So we're looking at fair market rent. 2-bedroom here in Greensboro, as of this year, you need at least $859, almost $17 an hour for a living wage. And then when we compound COVID-19 on top of the things that you just heard Kim describe, on top of the data that I just mentioned to you, all of that gets exasperated. Businesses are closing. Some businesses are not coming back. So this thing is in our environment, our economic stability has been impacted across the board. And you can see how COVID-19, this compounding effect where our numbers have gone up since March drastically. These are cumulative COVID cases in North Carolina. So when you're already cost burdened in a home, barely making ends meet, which is what we see. We see individuals coming in where, right now, the going understanding is stay home, don't travel, of course, be protective, wear your mask and things of that nature. But when living at home is one, not an option, or if you are having to stay at home and the home is literally making you sick, and then you compound COVID-19 on top of that, you can understand how your housing vulnerability increases and your risk of homelessness increases. What we're seeing here at Greensboro Housing Coalition, in a short period of time, after we received CARES Act dollars for rental and utility assistance, even prior to that assistance, we saw an uptick in our calls where people were coming in or are calling us in need of assistance. And in a 2-month period, we averaged over 11,000 calls. We went from 129 calls a day to almost 600 calls per day. And that is not abating. That is not decreasing. So what we're seeing right now on average, we're seeing roughly about 700 calls a day. In the same 2-month period, with our partnership with North Carolina Legal Aid, we have handled at minimum 100 eviction resolution cases in that same period of time. And in that same period of time, served over 1,500 people in need of rental and utility assistance. That's just in Greensboro. This data is similar to other cities across our state and across our country. So we're looking at trying to mitigate the compounding effects of COVID-19 for those that are at risk or at an immediate risk of homelessness. And we are seeing data such as 50 evictions in the month of May before that moratorium lifted. Because remember, we had one prior to the one that's in now, that we had a state moratorium. There was 50 just in the month of May. In August, we saw that increase. There were over 254 eviction cases in the pipeline, meaning we were building, the trend was building and increasing, and cases were increasing daily. Currently, we have 681 pending evictions in Guilford County, and that number is increased from the 400 that was reported in October. So when Kim was describing the policies and the necessary assistance that's needed across the board, we have to consider what that means and what that looks like in the context of homelessness. Of what should we do? What should our programs look like? How should they address the concerns and the issues that we're facing? Because if we don't have holistic programs that are effective and efficient, it's a losing battle. Because the programs that are needed are those that have prevention strategies to prevent the leading factors of homelessness. If we were already in a housing pandemic before COVID-19, and this is a compounding effect, your approach to preventing or mitigating those issues, you have to address the factors that were in play before COVID-19 even came into the picture. We have to be able to find safe alternatives and safe and affordable housing for individuals. The problem across the country, we are in a housing crisis, affordable housing crisis. So policymakers, our city officials, municipalities, federal government, we cannot create a siloed type of approach. The rental and utility assistance is great, but it cannot be just rental and utility assistance. There has to be a stabilization of assistance to those that are already experiencing homelessness. We need to have mental and behavioral health services, Medicaid expansion, flexible dollars for the organizations that are aiding in the assistance, that are ones that are boots on the ground doing the work. Oftentimes funding that we have received it's so restricted, it limits and creates a barrier instead of creating relief. Policies that address systemic root causes. We are in the midst of a social and racial uprising like we haven't seen in such a long period of time. And to sit back and watch the things that we've seen in our country, to sit back and watch George Floyd being murdered right before our eyes, we have to do not only make sense policies, we have to disrupt what's happening in such a way that we address the systemic issues that put all these factors in play. There has to be an equitable allocation of distribution of resources. And when I say an equitable allocation and distribution of resources, there's so much data and so much evidence that shows why COVID-19 is impacting some communities harder and some populations harder than others. That's not a secret. It doesn't take rocket science to understand if you have a particular area that has a disparate impact and you have resources to mitigate and lessen that impact, then the allocation, in order for it to be equitable, needs to be going to the most vulnerable first and then going from there. It's like a ground up approach. And we have to have partnerships that leverage resources in such a way that we not only build up the individual capacity of the person in the household, but the capacities of the neighborhoods and the communities. I read this the other day and it was so resounding in my soul. I just thought it was funny, but not funny, because it's definitely true. So when we give millions to bail out banks, it's good for the economy. When we give trillions to billionaires, it's good for America. But when we need money for veterans, homeless people, insurance for the sick, food for our children, Social Security for the elderly, all these basic things that's just what you need to live, it's like, oh no, that's a handout. When we see individuals in need and people are out here suffering, it is our collective duty to not turn away, but to work together in such a way that we do things that's just right, that's just, and just makes sense. Because at the end of the day, when our housing structure is impacted in the way that it is right now, that just does not impact the homeless or the low income or the moderately income individual or household. That impacts the entire city that you live in, county, state, and you're in the country. And so my hope is today that folks on this call leave with a new call of action within themselves to not turn away, but to find a new way to advocate for the change that will create the change in our communities that we need in order for there to be a longer term sustainability with those who need it the most. And so, Michael, I'm gonna pause there and then turn it back over to you.
Thank you so much, Josie. Such words of wisdom, and I really appreciate you sharing from your context. Yeah, thank you, Kelly, for pulling out those quotes. You left a lot of gems in that. So we're gonna go to the coast now and hear from Jess in Portland, Maine. Jess, it looks like you brought a lot of your friends talking to each other in the chat. So I'll give you a moment to turn on your video and start sharing your screen when you're ready.
Thank you, Michael. Hello, everyone. I am Jess Falero. I am non-binary and I go by they, them pronouns. I am 23 years old and I have been a civil a civil rights activist for the past 2 years. I've experienced chronic homelessness for the past 6 years after aging out of the foster care system. My organizing work has ranged from local policies, state level legislation, and founding the Maine People's Housing Coalition in Portland, Maine. Our mission statement is simple. We work daily in our community to end homelessness. Our organization is a coalition of unhoused folks, different groups such as People First Portland, Black Power, Maine Youth Justice, Youth Without Barriers, and other organizations around the city to provide mutual aid, peer support, and tenant advocacy. We also demand/call for open conversations around local and state policy about homelessness, led by unhoused folks, as well as engaging in direct action, all in an effort to end homelessness. Our work is led by unhoused peers, currently living in shelters, couch surfing, camping out, or experiencing chronic housing insecurity in our city of Portland, Maine. We work to identify the interlocking, intricate systems that oppress those in the unhoused community, as well as the intersections of systemic racism, mass incarceration, our failing child protective services, mental health, the overdose crisis, and how all that contributes to what we call homelessness. As the COVID-19 pandemic broke out in the spring, the already oppressive systems we have built in our country have reached maximum capacity and triggered a domino effect of need and suffering that our country already couldn't afford. People are dying on the streets at unprecedented and underreported rates every day that we aren't changing policies. The truth is, it is not our community's responsibility to fill in where people in power have failed. We didn't create the systems that are killing our members of our community. We are at the heart of our society's failures. From systemic racism to our housing crisis, to mass incarceration, to our failing mental health systems, to the pandemic. This is an unprecedented crisis that has already taken too many lives. On July 22nd, 2020, together with unhoused organizers, we demanded rights for our community. We set up camp in front of Portland City Hall and didn't leave for 18 days. Our encampment stood in solidarity with the Black Lives Matter movement and called for defunding the police and investing in social service programs, housing, critical infrastructure, and mental health. Our encampment demanded an overdose prevention site to save lives caused by outdated policies such as the war on drugs and the indifferent cruelty of those in power. We, the people who were and are still directly impacted by existing and failing policy, demanded that the governor, mayor, and others in power hear our needs. Extend the eviction moratorium until the end of the year, decriminalize camping out, and implement plans for affordable housing led by directly impacted people. On July 24th, we had a press conference where youth organizers spoke about their experiences and demanded change from our local government. About 50 activists from the Black Lives Matter movement cried out for justice for George Floyd and Breonna Taylor from the top steps of City Hall, starting out the press conference and leading us into a very impactful night. One of the main goals of camp was to educate housed folks and give them context to the failing systems, the symptom of homelessness, and the trauma and atrocities that come along with being unhoused and vulnerable. Housed allies and accomplices worked in community with unhoused organizers. Together we fed our community, clothed our community, and provided overdose prevention trainings. We stopped overdoses and saved lives at camp every day. We created within days a system that protected our community better than any government ever has. Our community created our own power. We did this ourselves. We didn't wait for someone in power to give it to us. My work often includes bringing people with lived experiences into meetings with the mayor, local and state delegates, and other people in power to identify systemic oppression within different institutions and then working to reform those systems. More often than not, those directly impacted are not given a voice or the simple respect for surviving the very thing we are aiming to end. This comes from people in power who have been involved in this work for extended periods of time, but have no context as to what homelessness is, and instead speak and act from a vastly removed position. We are the experts at our own experience. People in power who have the safety and security that my community fights for every single day deny even the most basic fact that we know what's best for our community. I often meet with people who are the heads of the very organizations I'm looking to reform. Part of bringing my peers to the table is so they have a platform to identify, address, and work to change the systems that are currently oppressing them. Being unhoused in these spaces can be complex, difficult to navigate and fully process. The stigma and bias is palpable. Dehumanizing, undignifying tactics and systems are second nature to people in power. We will not stand for it any longer. I'm going to continue working with my community to demand and organize for the rights we deserve. And we're not going to let people in power and systems of power continue to kill us. Thanks.
Jess, thank you so much for sharing your experience with us and giving of your time today. As you mentioned, you're still experiencing homelessness, and I know it was a big deal for you to make time and space and emotional energy for this presentation. I really appreciate you. We're gonna hear now from Rosemary in Minneapolis. And so we'll just not share any more slides and just kind of pivot to hearing from Rosemary, and then we'll have the remainder of the time for Q&A. So without further ado, I just want to turn it over to you, Rosemary.
Hey, can y'all hear me okay? Cool. So I'm happy to be joining you today from South Minneapolis, the epicenter of the 2020 uprising following the police lynching of shelter worker George Floyd here in town. And this day is especially significant too to me to be able to join you all because it's also the 4-year anniversary of the Battle of the Backwater Bridge at Standing Rock, which is a moment for me that really recommitted me to movement work. I've been involved in the homeless service industry for a long time now, and movement adjacent. And that moment 4 years ago on the bridge when police were attacking us with water cannons and blowing people's arms off was a moment that made me recalculate the kinds of risks that I'm willing to take to be committed to these shared values around land and life. I think it's relevant too to just say right away that housing is land. And when we're talking about homelessness, I don't think that we can separate that particularly here here on this land, on occupied Dakota territory, we can't separate homelessness from this 528-year legacy of land displacement and settler colonialism, a process that looks very similar to gentrification in urban areas today. Here in Minnesota, Native people are 25 times more likely to be homeless than white Minnesotans. And that's something that I see in my work on the street, doing outreach. And I just want to be really clear too, that I'm not here to speak for my employer. I do like my job and I'd like to keep it. I also advocate off the clock, and would like to speak to some of the work that that we were able to pull off here in Minnesota over the last 6 months. This day is always a day of reflection for me over the last 4 years. And so just thinking too about with the fight against the Dakota Access Pipeline, thinking about the way that Hennepin County sent law enforcement to so-called North Dakota to protect the pipeline, using a so-called mutual aid agreement. I think with the pandemic, we have seen a reclaiming of mutual aid and like understanding a little bit more deeply about what mutual aid really means, and building solidarity between housed individuals like myself and our unhoused neighbors. In the spring in Minnesota, we saw that when people who work in the industry partnered with people who were not working in the industry, who are housed activists, housed neighbors, to pull together and support and really make visible the issue of unsheltered homelessness here in town. I think it's important for us to understand that a lot of the narrative around homelessness locally through our own office to end homelessness is a false narrative, one that insists that there are shelter beds available and thus putting the blame for not using those beds on individuals rather than understanding this broader system. And it took those mutual aid efforts to really counter that false narrative. And it was that type of community building that led to the capacity to take more direct action. In the wake of George Floyd's killing, during the uprising, we were in a time period where we had been pressuring the county, the government to open up hotels as a logical answer to the COVID-19 crisis. And some hotels had been opened, but people who are unsheltered were systematically disenfranchised from accessing those spaces. People who weren't interested in participating in the coordinated entry system were denied access to those things. When Black and Brown youth in Minneapolis burned down the police station, that is when we saw some opportunities and some openings that forced more opening of hotels and relocation of a camp blocks from the site of the 3rd precinct. It took that type of community outrage in order to be able to move policy, and it still wasn't enough. The day that we had National Guard invading our city, there were still people left behind. There were people who were outside, curfew was following, tanks were rolling past, and there were no shelter beds available. There are no county operated beds available in the entire, throughout Hennepin County. And so we had no choice but to try and find an alternative and take direct action. And so we took over a hotel. And I want to stress that the good intentions and the good work that we can do through our day jobs isn't enough. We need to take direct action and to really look at these deeper roots of what is causing these inequalities. When that first night, as we opened the hotel, we had people coming in throughout the night with some of the most terrifying stories that I had ever heard of experiencing homelessness. There's somebody that came in with an injury from live ammunition fired from somebody in a National Guard uniform. You know, we had people coming in with stories about actual KKK going around their tents, stomping around their camps while they're hiding in their tents. It was one of the most scary nights that you could imagine. And so we had to create this sanctuary space for people to be welcomed. During the course of the 2 weeks that we were able to keep that space open, we were housing 300 to 400 people. There was about 700 people that passed through there. It's about the same number of people that are officially recognized last summer as unsheltered in Minneapolis. So we need to be realistic and know that sort of technocratic responses to homelessness aren't going to do much more than manage poverty. We need to redistribute the resources. I want to make sure that we're staying grounded with that too. And remember that simple resource distribution is different than redistribution. This is about changing power and less about doling out individual hotel rooms or individual tents. This is about long-term redistribution of power, and land is a major source of that. So housing and land and understanding those things together and being really place-based about that work is deeply important. To fast forward to today, 6 months after the uprising began, COVID numbers here are surging. There's dangerous outbreaks in our shelters. There's not enough hotel space. We still have vacant hotel rooms. There really should be no vacancy while there are people that don't have a place to live. We have shelter workers here that start at $12 an hour. So I want to make sure that we're also including some understanding of labor within this as well, and having that solidarity between housed and unhoused, between people who are working in the industry and people who are experiencing homelessness, people who have been displaced from housing, and to build that solidarity up among us so that we can be in this fight together. It sometimes feels like we're losing ground, especially when temperatures drop. We're still seeing evictions from encampments despite CDC guidelines. You know, sometimes bringing up CDC guidelines is seen as advocacy, and advocacy is not what you're supposed to do on the clock. And this is part of a bigger pattern too that I've been seeing of emergency management as a discipline co-opting public health in these responses. These need to be, when we're talking about a pandemic, we really need to be relying on public health rather than on emergency management as a discipline. I remain hopeful with the kind of activation that we've seen in the last year, but we have a lot in front of us, and it's going to take a lot of work and a lot of unity in order to be able to tackle what we're facing. So I'm thankful to everybody that is here and willing to take that kind of direct action in your own communities and be able to do things beyond what this industry has as its own container.
Rosemary, thank you so much. As you alluded to, I don't know that everybody was aware ahead of time that George Floyd was a shelter worker, really well known in the community and the homeless services community. And so this hits home for y'all in a way that it may not in other communities across the country. So I appreciate you sharing what you've done. I'm going to ask all our panelists to turn their cameras back on as we pivot to some Q&A, and we have more time than I anticipated, so we'll try to wrap up at the hour mark if we can. So if those who want to ask questions to the panelists, please use the separate Q&A box to do so. It's easier for us to track those. But you can also just continue to chat with one another in the chat box, sharing your experiences of evictions, uprisings, all of it. I want to start by asking y'all, and I want to start with Josie on this one, just noting, you know, racism and white supremacy are more than 400 years old in this country, of course, but the uprisings of the summer were especially triggering and re-traumatizing. We're living in sort of an escalated level of racial trauma. As a leader of your organization, can you talk a little bit about how you've been able to support your staff, who I think you said predominantly people of color, in the midst of this heightened racial trauma? And what would you recommend others do in that space?
I recommend, I'll start with that first. I recommend people do what I did, and that's give your staff time to breathe. I read something during that time, and I'll just be very frank, where someone posted something and it said, hey, Black folk are tired. And so please do not come to them the morning after a killing that's public like that, that everybody can see, and ask for your updated contracts, you know? And I just know that week, the whole week was just very heavy. It was very emotional and it was exhausting. And that's just how I felt. And so I felt, I can't imagine what my staff is feeling in the midst of this pandemic. And they are seeing these thousands and hundreds of people during the week, and they're having to keep it together while they provide aid and relief to the best of their ability, while they're absorbing, seeing, and processing what has played out before everyone. And so considering that, I sent out an email and acknowledged the pain or the emotion that they may be feeling, because I feel that's another thing you should do, is not ignore what's happening, but acknowledge it, say what it is, call it out, and stand with those who are experiencing that and give them what they need. And that's just a moment to breathe. And so I gave everybody opportunity to shut down, because I knew if the work that we do, they would be no good to anyone if they were just kind of stuck in that emotion. And I know I was having problem thinking. I was having problem processing. And at that moment, in the early stages of the week, I had not realized that I had a traumatic response of fear to what I had seen, until my husband later in the week said he was going out to the store at like 8, 9 o'clock at night. And I immediately, it was 0 to 100 quickly. And I was in fear. And I was like, no, you don't need to do that. You don't need to go out and do anything. Like, he was like, I'm going to get printer paper. I was like, you don't have to. And I just got very irate with him, not realizing what I was doing and not realizing that I had an emotional, traumatic, fearful response to to my experience that week in seeing what had been playing out. And it wasn't just George Floyd during this period of time. You know, it was Breonna Taylor, and it was Arbery, and it was all this that kept playing out before our eyes. And it was just too much. And so even now, my staff knows you have the opportunity to step back. All you have to do is just say what you need, and I'm giving it to you. Because I know if you have time to collect yourself and reflect, and you take what you need, you'll come show up even stronger for our community members that are in desperate need. But without that, you can't do that. We'll be fine. And I think people just need to understand that as organizational leaders, and just your organization, I don't believe in hiring people I can't trust. I trust you till you give me a reason not to. So I trust my staff that they'll do the best that they can. And I trust that they're going to create as much relief as possible for those in need. And so what would I look like? What would that be like if I did not allow them opportunity to just take a moment to breathe, when I knew how I was experiencing that? So I basically put myself in their shoes. And these are not just my staff. This was once my peers. I just took on executive director role on April the 6th. And these staff members I have were my peers, and I too was staff. And so it's just a different, I don't know, maybe I just understand it differently. And I just looked at it. That is what I would have wanted if I was on the other end of that. And I just could not go throughout the day that day without allowing that. And so I'm hoping that anyone that's leading an organization will just take a moment and allow that for their people, especially throughout this time.
really thank you for modeling leadership that we should all aspire to, honestly. Similar question to the rest of the panel, if you have something to add about how we hold space to heal and recuperate from consistent trauma that we're all experiencing. If anybody has anything to add.
You could try taking over a hotel with a jacuzzi. I don't know.
More taking over hotels. That's the punchline, right?
I'm in.
And anytime somebody asks you how you're going to pay for something, the answer is defund the police.
Yeah. Well, say more about that, Rosemary. You know, the Minneapolis received a lot of attention when, you know, the city council, I guess, said that they were going to dismantle their police department. It's November 20th, 2020. What's going on there now in relation to what we're talking about?
Yeah, so for those of you that are in the area, the 2021 budget is currently being debated in City Council. There's a couple of budget hearings coming up, so you can follow Black Visions Collective and Reclaim the Block to find out how to offer your own testimony and influence that public policy process. Recently, the City Council did approve a $500,000 increase to the city budget, including some of the same people that pledged to dismantle our police department in a photo opportunity in Powderhorn Park, which was the site of the largest homeless encampment in the state of Minnesota earlier this summer. So, you know, there's these paths to change through electoral processes. There's these paths to change through lobbying. I'm glad there are other people that are more skilled in those things. I do encourage people to remember that direct action is an option, and to be thinking about ways of implementing the changes that you want to see happen and using that as a way to leverage some of those things so that you can hold the door open for others. Yeah, we're looking at a lot of backtracking, and just to really be clear too, the history of policing and the history of social work and other interventions like that are really, really tied together in our country. So thinking about ways that we may be participating in those processes or acting as police of resources or surveilling the people that we're working with, I think is something that we all need to kind of grapple with if we're working in this industry. When we rely on police to show up for mental health emergencies, when we have it as a policy that you have to have a police presence if it's a behavioral health call, and then it takes over an hour for them to show up anyway, like that's not safety. Like, let's think about what really makes us safe. Housing people makes us safe, you know, how taking over that hotel and housing people in that hotel in May kept that building from being burned down that night, you know, like this isn't like yeah, I just, we gotta take safety seriously. And that means realizing that police don't keep us safe. We keep us safe.
Just responding to another question in the Q&A here. We were thinking about, so as I said at the beginning, it's like 6 big crises that we're framing in this winter is coming thing. And we paired them as best we could. If folks don't naturally see the connection between an eviction crisis and uprisings for racial justice, does anybody want to connect the dots for folks?
I can take a shot at that, and please, everyone, feel free to chime in with your own thoughts. But I think there's a through line from through American history, right, that ensures people of color do not have access to the tools to build economic wealth and security. And it has led to the conditions that we see today, right? And so with this eviction crisis that is just simmering and waiting to overspill, we know that Black and Brown communities are going to be the hardest hit. And we know that that evictions have serious repercussions for people who experience them. Of course, it's emotionally and mentally devastating, but there are also health ramifications and longer term, it makes it harder to find safe, stable, affordable, accessible housing in the longer term. And so with this eviction crisis that will disproportionately impact Black and Brown communities, we need to understand that this is the result of an inherently inequitable system that was built on the disenfranchisement of people of color. And so the uprisings that we're experiencing now, likewise, are the result of generations upon generations upon generations of oppression. And so all of those things are linked and cannot be taken apart. They cannot be sussed out. Yeah, I don't know if there's stuff that other folks would like to add.
One thing that I just want to put out there too is that I don't want to see rental assistance becoming landlord assistance, and I don't want to see our efforts to put people in the hotels to be a subsidy to the hotel industry that's then taken away from the people living there. So when we're talking about evictions, I want to make sure that we are also including people who are staying in the hotels now. We need to keep the hotels that we've won so far, and we need to expand that model, and we need to make them permanent housing. We don't need that as public infrastructure in a time of a pandemic. People aren't going to be using them. Like, let's make that infrastructure that already exists so we don't have to wait for another round of capital campaigns or another round of like one pet project being approved by your state legislature per year. Like, that is existing infrastructure that could become public housing or social housing. And historically has been, like single room occupancy has been in hotels in the past. This is not a new concept. So really being able to include a wide range of housing in our understanding of this eviction crisis.
Absolutely. And I think Jess said this during their presentation too, but there are hotels, but and also houses that are just sitting vacant while people sleep unhoused, unsheltered on the streets. And that's an unacceptable condition.
And big ups to the folks in Philly that were making sure that they were making use of the existing public housing that had been abandoned. We can't let public housing, the Public Housing Authority turn into a tool for gentrification. And all of these infrastructures that were established and under the auspices of, maybe the roots in New Deal era programs, or maybe roots in the war on poverty, like if you look at that history closely, you can understand a little bit more too about how racial capitalism has played a role in the design of all of those things and the continuation of a caste system in our country. Yeah, we like the tools that we are caught up in and that we participate in through this work and advocacy. Like, we just got to make sure that we are sticking true and following a compass and looking towards a horizon of actual redistribution of resources, and not supporting this existing system through Band-Aids at best.
Josie, were you going to say something, or Jess?
I was just going to say, we're talking about policies that are embedded in a racialized social structure. Like, there's a deep systemic issue that, in order for change to happen, it has to be completely disrupted, destroyed, and uprooted. We're looking at dealing with the disproportionate impact because we're looking at not even a residue, but the still existing of exclusionary policies and policies embedded into red line practices. all that still exists, right? So it's funny to me when I'm listening to people on news or whatever, and like there's this surprise of the disproportionate impact that COVID-19 is having on certain communities. It's not rocket science regarding the why there's this disparate impact, because we see it in investment in our communities. We see it in the exclusionary zoning practices that municipalities control through planners. We see it in our healthcare and access to healthcare, as we saw COVID-19 testing show up so much later in some areas and communities than others. So, I was just talking about this the other day with someone, and I mentioned the fact that until you disrupt, destroy, and uproot that which these policies and things are embedded in, until we redefine the things that perpetuate what we are fighting against, we're not going to get anywhere. And so when we're looking at what is at the root of the issue and how do we get rid of that, that's the conversations I'm trying to be a part of. And at the same time, if there needs to be a direct disrupt or destroying of something, then so be it. Because at the end of the day, there's no way that we will get on the other side of this and leave things in place or create things now so we can be better on the other side of this without that type of uprooting and destroying and getting rid of those things that perpetuate the very thing that we're talking about. And that's just how I see it. And so, for us in our agency, for me, my thing is just standing firm on what I value and what I believe in. And it's very, very personal for me, because my family still lives in the communities we're talking about. I grew up in the communities that we're talking about. And for me to have experienced homelessness in my life in the early 2000s, and then still here in 2020, seeing these same policies, systems, and environment that is perpetuating these cycles of homelessness, and what we're seeing play out, it's exhausting. But I do believe that there has been a shift. There is a shift going on right now, that this is not a trend that we're in. And so I am so proud to be on this panel with all of you, and Rosemary, and just his resilience. I mean, it's just, I don't know, this is just gives me energy, and it gives me hope to say, okay, yes, somebody's out here getting it in. So that's just how I feel about it. And so anyway, I can support that. That's what I support. And so when we're talking about evictions and landlords, I understand both sides. I manage properties. This is how I look at that. We need rental utility systems and those things. Because at the end of the day, if you're a renter, someone is owning that property. And what I don't understand is why there's a lack of understanding. And we just had all these lessons learned from the 2008 housing crisis. Properties were abandoned left and right, and people were taking up ownership of properties that were left empty because they were disrupting and they were trying to uproot what was going on. That is going to happen again, because at the end of the day, our housing structure being impacted the way it is and affecting the lives of people, and the government colossal failure of what we have seen for the last several years has done nothing but cause these things to exacerbate the issues that have already existed. And so as we move forward in creating changes amongst ourselves and the people that we work with and in our communities, it has to be an even greater power shift with the people like on this call, the people that we work with. And we have to hold people accountable, and we have to stand on what we value. And so when I'm partnering and doing things, I just mentioned someone, I'm not working with slumlords. I have certain programs, and so they're banned. Like if I want to help the tenant, and I'll do that through another means, but I'm not helping a slumlord where a tenant is already in need and your housing is making them sick and you're not doing anything to fix it. So if someone doesn't like that, then you just don't like it. It'll be all right. You'll be okay. Just go away. That's just how I see it. Yeah, so it's fine. And that's what we have to do. You have to just stand your ground. And that's the only way I think change is going to come.
Well, y'all, I could hang out with you the rest of the afternoon and into the weekend. I am noticing that our attendees are tapering off here, so I'm going to go ahead and draw us to a close. Those of you who are still with us, take a look at the screen with lots of opportunities to get involved in our work. The council is a network of people who love each other and support each other in the movement. So please get involved with us. My deepest gratitude to our panelists today, Rosemary, Kim, Jess, Josie, and Brandon in the background helping us with tech support. You guys have really made my day, and I'm just really grateful for the work that you do. If you're still hearing my voice, when we close this meeting, a survey evaluation will open in your browser, I'm pretty sure. So please take a moment to tell us how we can improve work in the future. Thanks again to our panelists, and we'll go ahead and close it.
Thank you.